For the patients, I want to always, tell them, you have to be brave somehow. Medicine is changing. I want patients to become more well-informed than now they do.
As you already have to treat your patients here in Korea, what is your motivation then for going abroad to other countries?
At a certain point, if you become a surgeon and you do a lot of surgeries, you can't learn anything from the others anymore, or just doing your surgery will not improve your surgical skills that much. How to improve that? I believe you should train the others so that you can objectively see how your surgery, what your surgery is. Some of the surgical steps you have to categorize and you have to logicalize your surgery so that you can explain it to the other surgeon. In that process, you can objectively appreciate your surgery and can improve your surgery afterwards.
So you're always learning, always improving, always teaching others.
Because nobody is perfect. I'm not perfect yet, and I won't be able to do it. So it's a lifelong, process.
And we understand you want to spread awareness for this surgery. What's the reason why?
I believe surgeons and medical, personnel and medical industries we should give more attention and our attention to the quality of life treatments. Penile implant and the surgery for erectile dysfunction is not a critical illness treatment. You don't need it to live. It's another life for that disease, but still, it impacts man's life tremendously. I think it is fair to say if the patient knows that treatment but still doesn't want that treatment, it's a fair situation. But many patients do not able to get this surgery because they don't know it. I don't think that's a fair situation.
Then, do you have a parting message for future penile implanters or potential penile implant patients?
For the patients, I want to always, tell them, you have to be brave somehow. Because admitting that having a condition like this as a man is a very embarrassing thing. But once you talk it out with a proper surgeon or doctor who can help you, you will get a much better response from them. It's your choice. It's not life or death. But if you feel like that you are suffering from it, you don't have to waste your life like that. We are striving to live a happier life, isn't it?
And do patients usually know what they want when they come to you?
Actually, not many people know what they want in the first place. So giving them enough information so that they can decide whether they want this treatment or not in ahead of coming to the practice. As we know, there's many tools these days, platforms these days, like a YouTube or Google or many things you can utilize, patients can utilize. They have a much better access to the medical information than before. Like this filming as well, I want to provide them information so that they can educate themselves and find a better treatment for them. Medicine is changing. I want patients to become more, well-informed than now they do.
How about for the future
for the surgeons?
implanters?
Many surgeons fail that because they try to treat the erectile dysfunction patient just like the prostate cancer patients. They are different. That's the first thing they should understand. If they want it, they will have a much happier life. Because many patients with the penile implant will reward you after 6 months of the surgery. Surgeons become happy people due to their patients' happiness. I just want to tell them that if you are willing to come to the path, you will have that in your future.
And how do you see this surgery in the future?
We all look different, right?
Yeah.
And we all have a different body and anatomy and characteristics. But current medicine is not able to meet the differences of each and every person. But I guess in the future, we will be able to, meet the differences of each characteristics so that we can serve our patients better.